Hello everyone, welcome to my life. My name is Pharmacist Rubby. This is my first live, so we are going to do this together. If we have up to 5 persons, we can start, okay? If we have up to 5 persons, we can start. So invite your friends. Our topic today will be on major causes of infertility in women. You know, infertility has become the order of day. If you meet 10 women, 4 out of them is infertile. So we need to discuss it. And there are so many causes of infertility. So many causes. So we need to discuss but a few today. So invite your friends. Let's talk about it. This is not something to be ashamed of. Okay? This is something that affects us women. So we need to talk about it. If we don't talk about it, how do we find solution? You need solution. I need solution. Your neighbor needs solution. So we need to talk about it. There are so many things you don't know that you're doing wrong, that you need to know better. Maybe if you start doing those things right, you can take in, you will conceive. Do you understand? Good. So invite your friends. Invite. We'll start with the definition of infertility. What is infertility? Infertility is simply defined, without any confusion, without you getting confused. In simple terms, when you and your partner have had unprotected sexual intercourse for a period of 1 year, that is 12 months, without getting pregnant, that is infertility. Do you understand? If you have had unprotected intercourse for a period of 1 year, please ignore the noise, okay? I'm in a very open place, so if you hear noise, ignore it. So as I was saying, infertility is simply defined in a simple term. It's simply defined as, when you and your partner have had unprotected sex for a period of 1 year, that is 12 months, without getting pregnant. You have had sex for a period of 12 months. You didn't get pregnant. You did not even have miscarriage. Do you understand? You did not get pregnant at all. That is infertility. Do you understand? I hope you're not confused. Now, what are the causes of this infertility? I get this question a lot of times, okay? Fam, I see my period every month, but I'm not getting pregnant. Fam, I see my ovulation every month, but I'm not getting pregnant. You can see your period every month, but you are not ovulating. You can still ovulate every month, okay, without getting pregnant. Meaning there are other things that are hindering you from getting pregnant. Okay? Now, let's start from endometriosis. Endometriosis is one major causes of infertility. Do you understand? Good. Pardon my grammar. I know that you understand what I'm saying. Now, what is endometriosis? Endometriosis is when the lining of the uterus, the lining of your womb, do you understand? When similar tissues, like the tissue that is found in the lining of your womb, is found outside your womb. Every woman has womb. You have womb. You're a woman, you have womb. I have womb. In the womb, there are tissues. Do you understand? Good. So when similar tissues, like those tissues that are found in the lining of the womb, when similar tissues that are found outside the womb, that is endometriosis. You can find this in the ovary. You can find it anywhere. This is one major cause of infertility. So when this happens now, during your menstrual cycle, okay, every month you see your period. Okay, so when you are about to see your period, the lining of your womb will shed. Okay, when it's shedding, it will come out as period, blood. Good. You understand what is period? So as it's coming out as your period, wherever this similar tissue is found, it will also be shedding. If it's found in your ovary, it will be shedding. Do you understand? Now, as it's shedding in your ovary, the blood will be trapped there because there's no place for it to come out. Are you getting me? As it's shedding in your womb, it will be coming out as your menses. But as it's shedding in your ovary, there is no way for it to come out, so it will be trapped there. Do you understand? Over time, it's going to make the ovary to start misbehaving. Yeah, it's going to cause cysts for you in the ovary, ovarian cysts. This is one major causes of infertility, and it comes with heavy bleeding, severe bleeding, and pains, lower abdominal pain. Okay, so if you're not if you normally have menstrual pain, and over time you now start finding out that this menstrual pain is very heavy, very heavy. Okay, not heavy, the menstrual pain is severe, very severe. Don't just ignore it. Don't ignore severe menstrual pain. It might not be normal, it might be endometriosis. Do you understand? So if you are trying to conceive and you normally have severe menstrual pain and heavy bleeding, do not ignore it. Go to the hospital and seek medical help. Okay, it might be endometriosis. Now, this is number one causes of infertility. Okay, now we have other causes of infertility. We have man's problem. Yes, most of you don't remember your husband when you're looking for a baby, when you're trying to conceive. You don't remember your husband when you're going to the hospital, when you're trying all manner of things. You don't remember your husband. There is something called man problem. Excuse me. The problem could be from your husband. Low sperm count can be the reason why you're not getting pregnant. Do you understand? Low sperm count. Now, apart from low sperm count, your husband can have enough sperm, but what of motility? Does this sperm swim? Do you understand? Do they swim? Because if this sperm are sluggish, They cannot get you pregnant. Sperm that is sluggish cannot swim fast enough and get your fallopian tube before it reaches there to die off. Do you understand? What is the shape of this sperm? Does the sperm have two heads? Does it have two tails? Do you understand? If a sperm is not normal, if a sperm have two head or two tail, it cannot get you pregnant. You understand? So the motility of this sperm matters, and the shape of this sperm matters, and the volume of this sperm matters. So if you are trying to conceive, take your man to the hospital. Okay, let him do semen analysis. Let your man do what? Semen analysis. Semen analysis is very, very important. Okay, don't ignore it. Good. Another thing that can hinder you from conceiving is fibroid. Do you have fibroid? Have you done scan? You should go and do scan. Okay, scan will dictate if you have fibroid or not. Your fibroid can be big enough that it's going to cover your fallopian tube, block your fallopian tube. And if your fallopian tube is blocked, the sperm, when you have intercourse with your husband, the sperm cannot pass and go and meet the egg. Do you understand? If your fallopian tube is blocked, sperm cannot go and meet the egg and fertilize, because there has to be fertilization. So you should go and do scan to check if you have fallopian tube and to check if you have fibroid, and to also know the position of this fibroid. It matters a lot. Do you understand? This is number 3 point now. The first one is endometriosis. Second one is for you to take your man to go and do semen analysis. Okay? The third one is for you to go and do scan. Go and do scan to check if you have fibroid. Okay? Good. Then number 4 is ovulation problem. You might be seeing your menses every month. Every month you see your period. Every month you see your period. Your period runs for 4 days or 5 days. Very normal. And you think you're okay. Do you understand? Fam, I see my period every month and yet I'm not conceiving. You can see your period every month yet you're not ovulating. Do you understand? I hope you're not confused. You can see your period yet you're not ovulating. Yes, it's possible. Go and do hormonal profile test. Okay? Go and do hormonal profile test. Hormonal profile test will tell you a lot of things. Okay? Take the result to your doctor. Your doctor is going to know what to do. Okay? Your doctor knows what to do. Do hormonal profile test. Don't see if you are trying to conceive, don't sit at home and you continue trying. You have tried for a year, 2 years, you are still trying on your own without any help. It's very wrong. It's an error. Do you understand? Good. You seek the help of a gynecologist to help you. Okay? So go and do hormonal profile test to check if you are ovulating. Okay? Use ovulation kit. You can use ovulation kit to track your ovulation. Okay, it's going to tell you if you have ovulated or not. Okay, so when you're using that kit, if you know, first of all, you need to know how to calculate your ovulation and how to calculate your cycle length. Can you calculate your ovulation? Can you calculate your cycle length? All these are important. Now, let me teach you how to calculate your ovulation and your cycle length. How to calculate your cycle length is the first day you saw your menstrual period, okay? Previous month, you start counting. Count it till a day before you see it this month. Do you understand? Are you getting me? The first day you saw your period last month, you will count from that first day you saw your period